Welcome to MUF, Minutes Until Fit. My mission is to educate and spread awareness about health and life through this channel. The information contained in this video is of general nature and does not constitute medical advice. Talk to your doctor for your individual circumstances. Don't forget to hit the like button and subscribe to my channel at the end of the video. This week we will be talking about plantar fasciitis. Plantar fasciitis is inflammation of the thick band of tissue that stretches from the heel of the foot to each toe. Plantar fascia supports the arch and acts as a shock absorber during walking and running. Plantar fasciitis usually develops in stages. It may begin with a slight discomfort in the bottom of your heel or bottom mid-foot area or the arch of the foot. Discomfort noticeably when walking or running. Sometimes it feels like a rock is in one of your shoes. Pain only occurs in one foot in most cases. Causes of plantar fasciitis. Injury is one of the main causes of plantar fasciitis. Tight shoes or badly fitting shoes will trigger plantar fasciitis. Bare feet increase risk of plantar fasciitis because plantar fascia can be damaged more easily. Overstretching. A lot of stretching can damage the ligaments and muscles in the heel. Overweight people take shorter steps, which places more pressure on the heel, causing constant stress on ligaments. Work. Teachers, factory workers, athletes, waitresses, and people who spend most of their time standing or walking on hard surfaces will damage the plantar fascia gradually. Foot mechanics. People who have a high arch or who are flat-footed increase their risk of developing plantar fasciitis because their body weight is distributed unevenly when standing, putting more stress and pressure on their plantar fascia. Aging. More common in older people 40 to 70 years old. As we age, our bones and muscles become weakened, and over time the ligaments of the plantar fascia become hurt and damaged. High intensity exercise like aerobics, ballet dancing, and long distance running puts a lot of stress and pressure on the tissues and heel, causing wear and tear to the muscles and ligaments. Plantar fasciitis diagnoses. The doctor will perform a physical exam to check for tenderness and the exact location of the pain in your foot. Doctors need to make sure the pain is not coming from a different foot problem. The doctor will have you flex and point your toes to see if the pain gets worse. The doctor will also push on the plantar fascia to see if there's an increase in pain. The doctor will check strength of muscles, the health of your nerves, reflexes, muscle tone, coordination, balance, and sense of touch and sight. They will do an X-ray or MRI to rule out bone fractures or if it's anything else causing the heel pain. Plantar fasciitis complications. You can develop heel pain, chronic heel pain if you ignore the condition. You could change the way you walk and cause injury to your legs, knees, hips, and back. Steroid injections can weaken the plantar fascia ligament or cause rupture of the ligament. Surgeries put you at risk of bleeding, infection, and reactions to anesthesia. Plantar fasciitis treatments. Decrease of inflammation in the plantar fascia ligament is a huge part of treatment, but it doesn't address the damage to the ligament. Stay off your feet and apply ice for 15 to 20 minutes, 3 to 4 times per day to reduce swelling. Reduce exercise activities. Try arch supports in shoes or try doing some stretching exercises to help relieve the pain. Motrin, Advil, and Aleve often reduce inflammation in the ligament. Injection of corticosteroid directly into the damaged tendon. Physical therapy helps to stretch the plantar fascia and Achilles tendons, show you exercises to strengthen lower leg muscles, help to stabilize your walk, and lessen the pressure on the plantar fascia. Plantar fasciitis prevention. Make sure to wear some type of shoe when walking or running. Do not walk barefoot. Wear shoes that are not too tight and that fit comfortably. Do not overstretch during exercise. If you are overweight, take steps to decrease your weight. If your job consists of long standing, take breaks as often as you can. And if you're standing on hard surfaces, ask the employer for a mat to stand on. Take good care of your feet by giving yourself a pedicure and massage the feet after a long day's work. This has been your host, Imani. Thank you for tuning in once again. If you have any questions, suggestions, or comments, feel free to email me at minutesuntilfit9.com. And as always, be safe. And if you have any comments, you can also leave me a message on the YouTube channel. Good day.